Hi everybody, it's Dr. Sandy Cremers. Even though I am a doctor and a surgeon, I'm also the mother of 6 kids, and a bunch of friends have been asking me what we use in the winter time to try to prevent illnesses, viruses, bronchitis, pneumonia in our family. I've made a couple of these videos before for my family themselves and also for friends, but I want to do an updated video because this has even worked better. So in my family, the family members that do this protocol, including myself, generally don't get sick. We don't come down with a full bronchitis, pneumonia, the cough that lasts for months. And so I want to just go through what we do. And so in a previous video, I told you the first thing that I do would be to, get home, get to bed, hot shower, all these things are still true. But I have found that trying to make yourself sneeze, and I'm actually not sick right now, but recently, a couple of weeks ago, I was starting to come down with something. And I find that when I put a little tissue, I'll roll it up, take a little tissue like this, and just kind of roll it up into a small kind of little, almost like a little stick. And then I'll make it very, very tight and kind of very, very super thin, thinner than this, like this. Just roll it up, thin it, very, very thin. Stick it in the back of the nose and just tickle your nose, or even if you just do a little bit, you'll start to sneeze. And you want to do it over and over and over again. Ideally not around anybody that you can contaminate with the virus, because you're coming down with the virus. So I do that frequently, and I find that kind of tries to decrease the viral load. So the name of the game is decreasing the viral load before it gets into your bloodstream and into your lungs. So I'll start that first, try to make myself sneeze. I'll take my zinc, which is, I use Coldies. I have the actual package, looks like this. I like sugar-free Coldies. It only comes in cherry right now. It has a box that says Cold Ease, C-O-L-D-E-E-Z. You can kind of see that there. And I'll usually take that about every 2 or 3 hours with food, but not with anything like magnesium or calcium. And that's, used to say it on the box. I think it still does. I'll take my vitamin D3, which usually I'll take more of in the winter time because that decreases naturally in the winter. And I'll take 1 or 2 quercetin. So these are my wonderful antioxidants. And I've seen some papers on some of this, but most of this, I haven't seen any papers. So this is kind of very natural, a little kind of not randomized controlled prospective studies out there that I could find. But we've been using this before even COVID hit. And then I made those videos during COVID. The next step is kind of what we started really using to kind of prevent COVID and other things that I still think helps. So as soon as a child starts to have any sniffles, I will have them take 2 alcohol swabs, and I'll just see if I have any, or not, just those little square ones, rip it open, take 1 for 1 nostril, just hold it there and just let them breathe just a little bit. And that's trying to kill any type of viruses, I think, in the nasal passage. And then as it goes through the nose, I will get a humidifier like this one right here, the humidifier, and we'll put a little bit of povidone iodine or betadine if they're not allergic. And for like 1 gallon, I'll put like 1 teaspoon to 1 tablespoon as long as they're not allergic. I've also been known to use, let me just show you the picture of my betadine, which is somewhere here. Looks like this. It has an expiration date, but I've honestly been using one for a while. And then hydrogen peroxide does have an expiration date, so I'll sometimes use a tablespoon of that for 1 gallon of water. And I've been known to just use more than that. So it just depends a little bit, as long as the child's not feeling it's hurting their nasal passages, which is, I've never had that with the humidifier. I sometimes have now done both. 1 tablespoon of hydrogen peroxide, 1 tablespoon of betadine. We have no allergies in our family, so just double check your kids are not allergic. And everything I'm saying, of course, as always, make sure you check with your pediatrician and MD first, but guaranteed they've never done it, they've never heard of it. So you kind of have to try it on your own to see if it works for you. But for us, it has been working for my family of 6, and I use it myself. Okay, the other thing I do, so the number 1 thing is making yourself sneeze, putting alcohol kind of swabs in your nose, just breathing that in to make sure you kill all those kind of pathogens. And then the last thing, which is the game changer, which has also helped, is nebulized either betadine or hydrogen peroxide or both. And I have used it when I really feel like I'm starting to get sick, and I really can't get sick because I have patients to see in surgery. So I take a nebulizer, which looks kind of like this. You can see that we had used this past weekend because one of my daughters felt like she was getting sick. And then I take my distilled water, which you can get at any pharmacy. It looks like this, just distilled water. I put it in the container. I take usually about a teaspoon of either Himalayan salt, which we have here, pink Himalayan salt, or something like, I've used iodized salt also, but usually Himalayan salt without iodine. Then I put a couple of drops of the betadine and then sometimes of the hydrogen peroxide, just a very little. It'll turn the solution brown, and then I'll have the child breathe it in. I don't put the strap over, or I'll breathe it in, and I'll usually do like a minute every 10 minutes or so, depending on how sick they are. I've had some kids that, have held it there for quite a bit of time. You just want to make sure they don't have any irritation, no allergy, of course, to any of these products like betadine. And then, of course, get them right into bed, hot shower multiple times a day, as hot as they can stand without burning the skin. Raise their temperature. Try to avoid any ibuprofen or Tylenol if you can help it, because that fever does kill the virus as well. Obviously, if they're throwing up, or they can't keep fluids down, or they have an autoimmune disease, or they're diabetic, or they're post radiation cancer treatment, anything like that, obviously check with your doctor first before doing any of these things. But I wanted to make this video for some friends because they've been struggling with illness after illness after illness. It goes through the whole house. So definitely think about doing some of these things. I think the most important in my family is making yourself sneeze right away, alcohol swabs, nebulizer with the whatever betadine or hydrogen peroxide in the room, and the humidifier, nebulizer, and those are the most important. But I pretty much drew all of these things, and we have it in one box, so that way when somebody's sick, we take out the sick box, so we can do that. And then I'm a big proponent of bone broth, and we do that even when we're not sick. So on the stove, there's bone broth brewing, which I'll offer to my neighbor, Beth. So if you have any questions, let me know. Good luck. Bye-bye.